The leading causes of death in the United States and its major contributors. The leading causes of death in the United States were as follows. Heart disease. Heart disease has consistently been the leading cause of death in the United States, accounting for a significant number of fatalities each year. Cancer. Cancer, particularly lung, colorectal, breast, and prostate cancer, is a major cause of death in the U.S. Chronic lower respiratory diseases, conditions like chronic obstructive pulmonary disease, COPD, and chronic bronchitis contribute to a significant number of deaths. Unintentional injuries, accidental injuries, including motor vehicle accidents and falls, result in numerous fatalities. Stroke. Stroke is a leading cause of death, with ischemic strokes, caused by blood clots, and hemorrhagic strokes, caused by bleeding in the brain, being the two main types. Chronic liver disease and cirrhosis. Liver disease, often linked to alcohol consumption and viral hepatitis, can be fatal. Diabetes. Diabetes-related complications, if uncontrolled, can lead to death. Alzheimer's disease. Alzheimer's and other forms of dementia are becoming more prevalent with the aging population. Kidney disease. Chronic kidney disease and kidney failure can lead to life-threatening complications. Influenza and pneumonia. These respiratory infections can be a cause of death, especially in older adults and those with weakened immune systems. It's important to note that the specific ranking and prevalence of these causes of death can change over time, and the COVID-19 pandemic had a significant impact on mortality patterns in the U.S. As such, it's important to refer to the most up-to-date data from the Centers for Disease Control and Prevention, CDC, or other relevant U.S. government health agencies for the latest information on the leading causes of death in the United States. Heart-related issues leading to death are often attributed to a combination of factors, and the specific causes can vary from person to person. Some of the major factors contributing to heart-related issues and fatalities include cardiovascular diseases. These encompass a range of conditions affecting the heart and blood vessels, including coronary artery disease, heart failure, and arrhythmias. Cardiovascular diseases are a leading cause of heart-related deaths. Hypertension. High blood pressure can strain the heart and blood vessels over time, increasing the risk of heart disease, heart attacks, and stroke. Diet and lifestyle. Poor diet, lack of physical activity, smoking, excessive alcohol consumption, and obesity can contribute to heart-related issues. A diet high in saturated fats, trans fats, and cholesterol can raise the risk of atherosclerosis and heart disease. Diabetes. Uncontrolled diabetes can lead to complications that affect the heart and blood vessels, increasing the risk of heart attacks and strokes. Genetics. A family history of heart disease can increase an individual's risk, as certain genetic factors can predispose someone to heart-related issues. Aging. The risk of heart-related issues, such as atherosclerosis and heart failure, tends to increase with age. High cholesterol. Elevated levels of low-density lipoprotein, LDL, cholesterol can lead to the buildup of plaque in the arteries, increasing the risk of heart disease. Physical inactivity. A sedentary lifestyle is a risk factor for heart disease. Regular physical activity can help maintain cardiovascular health. Stress. Chronic stress can contribute to heart-related issues. Stress management is important for overall heart health. Drug and alcohol abuse. Substance abuse, including illicit drugs and excessive alcohol consumption, can harm the heart and increase the risk of cardiac problems. Air pollution. Long-term exposure to air pollution, particularly fine particulate matter and other pollutants, is associated with an increased risk of heart disease. Infections. Certain infections, such as those caused by bacteria or viruses, can lead to heart conditions, like endocarditis or myocarditis. Preventive measures such as a healthy diet, regular exercise, not smoking, maintaining a healthy weight, and managing conditions like hypertension and diabetes can reduce the risk of heart-related issues. It's also important to seek medical attention and follow prescribed treatments if you have any risk factors or symptoms of heart disease to mitigate the potential consequences. Early diagnosis and intervention can significantly improve outcomes. Diabetes is a significant risk factor for heart-related issues and is often included as a major contributing factor to heart disease and cardiovascular problems for several reasons. Increased risk of atherosclerosis. People with diabetes are at a higher risk of developing atherosclerosis, a condition where fatty deposits, plaque, build up inside the arteries. This can narrow and harden the arteries, leading to reduced blood flow and an increased risk of heart attacks and strokes. Hypertension. Diabetes is often associated with high blood pressure, hypertension, which further strains the heart and blood vessels, increasing the risk of heart disease and complications. Abnormal blood lipids. Diabetes can lead to abnormalities in blood lipid levels, such as elevated levels of low-density lipoprotein, LDL, cholesterol and triglycerides, and reduced levels of high-density lipoprotein, HDL, cholesterol. These lipid imbalances can contribute to atherosclerosis. Insulin resistance. In type 2 diabetes, the body's cells become resistant to insulin, which is necessary for regulating blood sugar levels. Insulin resistance can also have a negative impact on blood vessel health and contribute to cardiovascular problems. Hyperglycemia. High blood sugar levels. Hyperglycemia in diabetes can damage the lining of blood vessels, making them more susceptible to atherosclerosis. Microvascular complications. Diabetes can lead to microvascular complications, affecting small blood vessels throughout the body. This can impact the heart by reducing its blood supply and causing damage to the heart muscle. Inflammation. Diabetes is associated with chronic low-grade inflammation, which can contribute to atherosclerosis and other heart-related problems. Complications. Diabetes can lead to various complications, such as diabetic neuropathy and retinopathy, which can affect an individual's overall health and well-being. These complications can indirectly impact heart health by limiting physical activity and affecting overall health. Because of the many ways in which diabetes affects the cardiovascular system, individuals with diabetes are at a significantly higher risk of heart attacks, stroke, heart failure, and other heart-related issues. Managing blood sugar levels and overall health is crucial in reducing the risk of heart disease for people with diabetes. This typically involves lifestyle changes, medication, and regular monitoring under the guidance of healthcare professionals. Cancer is a complex group of diseases, and its development is influenced by a combination of factors, including genetic, environmental, lifestyle, and other factors. Some of the major contributing factors to cancer include tobacco use. Smoking and the use of tobacco products are strongly linked to various types of cancer, particularly lung, mouth, throat, and bladder cancer. Diet and nutrition. A diet high in processed and red meats, low in fruits and vegetables, and high in unhealthy fats can increase the risk of certain cancers. Diets that are high in fiber, fruits, and vegetables may lower the risk. Physical inactivity. Lack of physical activity can contribute to obesity and increase the risk of certain cancers. Obesity. Excess body weight is associated with an increased risk of many types of cancer, including breast, colorectal, and kidney cancer. Exposure to ultraviolet, UV, radiation. Prolonged exposure to the sun and the use of tanning beds can increase the risk of skin cancer. Exposure to carcinogens. Occupational exposure to carcinogens such as asbestos, benzene, and formaldehyde can elevate the risk of certain cancers. Infections. Infections from viruses and bacteria can increase the risk of specific cancers. Examples include human papillomavirus, HPV, and cervical cancer, hepatitis B and C and liver cancer, and Helicobacter pylori and stomach cancer. Radiation. Exposure to ionizing radiation, whether from medical procedures, e.g., X-rays, environmental sources, e.g., radon, or occupational exposure, can increase the risk of cancer. Genetics. Certain gene mutations can increase the risk of developing cancer. While these genetic factors play a role in some cases, most cancers are not solely caused by genetics. Hormones. Hormones, such as estrogen and progesterone, can influence the development of certain cancers. For example, breast and uterine cancers are hormone-related. Alcohol consumption. Heavy alcohol consumption is linked to an increased risk of cancers, including those of the mouth, throat, esophagus, liver, and breast. Chronic inflammation. Prolonged inflammation can increase the risk of cancer. Inflammatory conditions like inflammatory bowel disease, IBD, are associated with a higher cancer risk. Age. The risk of developing cancer increases with age as genetic mutations accumulate over time. Family history. A family history of cancer may increase an individual's risk, particularly if close relatives have had cancer. Environmental toxins. Exposure to environmental pollutants and toxins, such as air and water pollution, may contribute to cancer risk. It's important to note that cancer is often the result of the interplay of multiple factors, and not all cases of cancer can be attributed to specific causes. Additionally, advances in cancer research are continually expanding our understanding of the disease and its risk factors. Reducing cancer risk often involves making healthy lifestyle choices, including not smoking, maintaining a healthy weight, staying physically active, and getting regular checkups and cancer screenings.